Hello, my name is Dr. Tom Gross. I'm a functional neurologist and I specialize in functional health restoration. I have a special interest in the neurobehavioral disorders of childhood, and I'm here today to talk to you about natural interventions and ways of overcoming these disorders. The neurobehavioral disorders of childhood include ADD, ADHD, autistic spectrum disorders, and learning disabilities, and also include things like dyslexia. And these are largely considered to be genetic disorders by most people, and the only therapy that most people would consider in terms of treating them are pharmaceutical interventions. What I really have a passion of helping people to understand the etiology of these disorders, and also that they can be overcome. Although there have been genetic roots and genetic influences that have been discovered regarding these disorders, and these disorders cannot be genetic because they are at epidemic proportions. They're increasing at such epidemic rates. And so there are not, and there have never been, genetic epidemics. What's important to understand about the genetic component of these disorders is that it's not chiseled and written in stone. It can be turned on and it can be turned off. And indeed, sometimes understanding the things, the environmental triggers that turn these genes on can be important in understanding how to come at helping people overcome these disorders. Now, considering the notion that most people believe that the only treatment for these disorders is medication. Medication, I don't dispute, can help many children have beneficial outcomes. Many children can take these drugs and they can sit still and focus, which is almost like a miracle in their families. But in functional health and functional medicine, many people have come to me through the years and they've shared stories with me that their children had very, very adverse effects to these medications. And they would never give these kids the medications again. It turned them into zombies. It ruined their appetite, things like that. And also, there have been preliminary research studies that suggest very strongly that even short durations of exposure to these medications may cause irreversible genetic damage to the DNA. And anybody who's had their children on these medications and who errantly or by whatever reason took their kids off knows that they're not a permanent fix, that very soon after the child comes off the medications, the behaviors and the problems spring right back, and in many cases they're worse than they were before. And statistically, even after years and years of medication, that the longest outcome where somebody may have some improvement after they come off the medications that I've heard is about 6 months. So clearly the medications aren't doing anything to correct the underlying problem at its root. But what we need to do in order to understand at the essence, at the root, what these disorders really are, they are at their root and their intrinsic expression neurodevelopmental disorders. And what I mean to say is that, let's say there is a genetic perturbation or some kind of a genetic influence, an environmental influence that affects the baby in utero or soon after their birth or during their early years of development. What happens is these are times when the brain and the nervous system is developing very quickly, very rapidly, by leaps and bounds. And the way that the central nervous system develops, when one area fires, it fires into multiple other areas, which in turn fire into multiple other areas. This is called divergence. All right, so this is a central and key theme to the neurodevelopmental roots, and it's really the key thing that we need to understand in order to know how to help an individual, is to do an examination and find out at what part their neurodevelopmental expression was stymied or hindered, and then go in and stimulate those pathways. And then they will, as they become stimulated, stimulate forward all of the areas that were adversely affected. In these neurodevelopmental disorders, the development itself is stymied, and because the development is stymied, then subsequent other areas are also impaired in their development, right? And so what do these areas of the brain do? Well, they as you get older, they're responsible for behavior. They may be responsible for your ability to inhibit motor expression. So if that doesn't develop, you get hyperactivity. They may be responsible for your ability to inhibit verbalization. So if they're stymied, then somebody can't inhibit what they say, and they have hyperactivity and they say whatever comes to their head. It may inhibit the ability that the areas of the brain that are responsible for their ability to stay focused and to sit still. And so if these areas of the brain are underdeveloped, then you'll have behavioral problems or behavioral concomitants. And it may be hyperactivity, it may be an inability to focus, it may be outbursts, it may be acting out, it may be primarily social, it may affect the academics, or it may not affect the academics in some children. And that's another important thing to understand, that there's a unique way that the development is hindered, and that unique way will be expressed in a unique form of developmental delay. So, everybody that has the diagnosis of ADD or ADHD or combined type doesn't really have the same disorder, do they? There's quite a few variations in the way that these things express themselves. And so, in order to be able to help these people overcome their individual disorders, we have to understand what aspects of, and as best we can, at what period of their development they were hindered originally, and then what subsequent areas are most affected. All right, and so what we do in order to discover that is we do a modified neurological examination designed to target these key areas of the nervous system that are underdeveloped and underfunctioning or overfunctioning. And by doing this, we can target therapies using targeted neurodevelopmental or neurological therapies, hemispheric integration techniques, and other things in order to help develop the areas that are delayed, starting with the original time of hindrance, which we would do developmental reflexes and discover which ones of those are hindered. And so it's important to understand that if, let's say, somebody is identified to have a auditory integration deficit, that there were a whole chain of causation. There was a whole number of things that happened well before the areas in the upper part of the brain that are responsible for integrating auditory stimuli were affected. And if all we do is integrate auditory inputs, then we may get some better auditory integration, but that's never going to go back and trace backwards and fix the neurodevelopmental root of the disorder. Let's say it expresses itself as a reading problem. Let's say Johnny's delayed in his reading by several years. Well, you could pay $100 an hour and go to a reading clinic and over the course of a year spend $1,000 or more, and Johnny can read better for a while, right? And maybe at some amount of that increased reading capacity will endure. But there's no way that that's going to go back through the neurodevelopmental history and fix the root problem. So the way that you make lasting, permanent changes to help these people grow out of their diagnoses is go back and identify the key developmental period that was hindered. And then you can target these areas in the upper, more advanced cognitive functions like reading and like auditory integration and like cognitive control or social issues and make some changes. Anybody who's looked for help outside of traditional medicine for these disorders has probably run across the biomedical approach. And in the biomedical approach, the emphasis is on identifying hindrances to health. And it's legitimate to some extent. If the brain cells have a very high metabolic rate, if there's something like a vitamin insufficiency or an infection or a toxin in the body that hinders metabolic function, then it's going to hinder brain function. And so many people that have gone off into this approach have experienced some benefit, and justly so, because they've identified some of the key metabolic issues that were either initiating variables perhaps, or mitigating circumstances, or perpetuating factors in maintaining these disorders. But even if you identify somebody has a B12 disorder, or they have an autoimmune disorder, or they have gluten intolerance, or if they have a B1 insufficiency, or some sort of anemia, and you get that fixed, it still does nothing to go back and correct the neurodevelopmental delay. And it's imperative that you understand, in order to correct these problems, you have to go back to the root problem. And by doing that, you drive the development of the nervous system in the same way that it originally developed.